Centers for Disease Control and Prevention have targeted 6 common and costly health conditions with 18 proven interventions. The 618 initiative is a collaboration with healthcare providers, public health workers, insurers, and employers who purchase insurance. To give us some insight on the 618 initiative is Dr. Raul Pino from the Florida Department of Health in Orange County. So, Dr. Pino, what are those 6 common health conditions?
So, in the 6 common health conditions, you have heart disease, smoking cessation, diabetes, teen pregnancy, hospital-acquired infection, and high cholesterol.
Okay, heart disease, stopping smoking, diabetes, what was the other one?
Teen pregnancy.
Teen pregnancy.
Hospital-acquired infections,
okay,
and high cholesterol.
Which one do you want to tackle first?
High blood pressure.
Okay. What are the interventions?
So what is critical about high blood pressure is to know that you have high blood pressure. And the issue with high blood pressure is because normally the increase happens gradually. People become accustomed to what they are feeling and not realizing something's wrong. You have a little bit of a headache today, you say, okay, I may have a virus. If you feel dizzy, I may need to get dehydrated. You feel hot, it may be menopause.
Everything except
everything
possibly high blood pressure. So what can you do?
Take your blood pressure. It's what we call know your numbers. If you go to a room and you say, do you know your phone number? Many people will know their phone number. If you ask people, do you know your social security number? Everyone raise their hands. And if you ask, do you know you have blood pressure numbers? You get like...
You get a blank stare, right?
Yes. And it's critical because it's simple. It's very easy to treat. It's very easy to control. And the outcomes are great.
Can you say that for all 6? It's easy to treat, it's easy to control, and the outcomes are great.
Yes.
Let's take hospital-acquired infections.
So the issue with hospital-acquired infection is when you get an infection at the hospital, those bugs have been exposed to antibiotics before. So it becomes very difficult to treat those with antibiotics. And also increase hospital stay for longer period and increase returning to the hospital after you get discharged. All that is increasing cost. And we were talking before at some point about washing your hands. And it is as simple as washing your hands at the hospital and the clinic and the clinical space.
So that one is a shorter hospital stays?
It will shorter your stay.
Okay.
It will decrease the amount of antibiotics that you are consuming. It will release people faster to home, recover faster, and go back to work.
So let's talk about the first one you mentioned, heart disease.
Yes.
We're hearing that, depending on the day, it's the #1 killer. So what are the interventions here?
So depending specifically of the condition, but the interventions can be, if you have a heart condition, to get your medication and to get what we call, for example, synchronization of your medication. Think about this. Anyone may be in 4 or 5 pills.
Okay.
And you have different dates to pick up your pill at the pharmacy. That complicates your life. So there are laws in place that allow everyone, independently on when your prescription happened, to get it all centralized and prescribed one day.
So that you'll know exactly when to take them and what combines with what.
And when to go and pick it up.
Okay. In Orange County, what are the big 2? Out of those 6?
Yeah, that's a good question. I don't know on the top of my head with exact numbers.
Well, which 2 are you worried about the most?
But if I was taking a guess,
yes,
it would be heart disease, and it probably would be hospital-acquired infections.
So where can people get more information and find out about the interventions?
So if they just Google CDC 618, they will go into the page that it describes each of the condition and each of the interventions that have been proven to be an impact.
So the bottom line in all of this is we all need to do a little bit of homework to keep ourselves healthy and to help our healthcare providers keep us healthy. So it's really more of an educational initiative than anything. Would you say that's true?
And also, you bring a great point. I mean, individuals, we are so interested in our investment. We manage our retirement. We manage our budget. We manage our household. Do we manage our health?
And that's a great question to leave with the audience, because your health is important to not only you, but everyone else in your life who loves you. So take charge of your own health by staying active, eating healthy, and seeing your doctor on a routine basis. And Google CDC 618 could save your life. Wash your hands too.